KCCI Close Up. Deal deadline. Congress has until midnight to pass a spending bill. We speak to one Iowa lawmaker about what needs to happen.
This is Iowa's news leader. This is KCCI 8 News Close Up.
Lawmakers on Capitol Hill say a coronavirus relief package vote could be held today. Negotiations continue over a stimulus bill and $1.4 trillion government funding package. A government shutdown could happen at midnight if no deal is made. KCCI's Cynthia Fodor spoke to Iowa Congresswoman Cindy Axne on what's in the bill.
This $908 billion deal is less than what the Democrats originally wanted. What's your response to it, and what do you make of it overall?
Let's get this done. We need a Christmas miracle here to ensure that the 3rd District and Iowans and people across this country can make it through the next several months. So listen, I'm glad to see that we seem to be coming to a conclusion. It's continually getting pushed back. I'm hoping that means good things, that we're finalizing some of those tough details, but it's time to get this done. Americans need it, and there's good provisions within it to keep people with money in their pockets and food on the table, help our small businesses, et cetera. So, and for our providers, healthcare providers, and of course, vaccines. So there's a lot we're working through, but I feel comfortable that we'll get something done. Unfortunately, it's coming really late in the year, and again, that's something where I believe that there's been a failure out in Congress, but the Senate's really been difficult to work with on this, and I'm glad to see we're finally coming to something.
Just to go through some of the points and your reaction to each one, the proposal for the stimulus checks, $600 or $700. Do you think that's enough?
You know, I'd like to see more in stimulus because the most important time to stimulate the economy is during downturns. But, you know, listen, what I'm most concerned with are the folks who are unemployed, the folks whose businesses are on the verge of closing, our healthcare providers who are literally stretched thin, our schools and our teachers who, you know, we need to make sure we keep these kids engaged and educated. That's becoming more and more difficult. It's a tough task. So we got support in for those types of things, and in for transportation, and for childcare. Those are the really big issues that are facing Americans right now with COVID. I'm glad we're able to get to where we need to be. I'd like to see more, but I believe negotiation opportunity passed, and here's where we're at. Let's get something done.
And the extra $300 a week in unemployment benefits, you think it's important to get that done since they are expiring by the end of the year?
That's really important to get done. That and eviction moratorium extension. We've got to keep a roof over people's heads, and we've got to keep money in their pocket. Listen, no child in Iowa should ever go hungry. We're already seeing that. We're seeing, massive amounts of folks going to our food banks, and I'm so grateful for everything that they're doing. But money in people's pockets is one of the most important things we can be doing. And we got to remember, even though I know this costs money, but the last time we had something like this, it was about a decade ago with a recession. We did not continue to invest in ensuring that we got up and running the way that we should after that. And we saw extended levels of unemployment. We don't want to come out of this with that. We want to keep people with money in their pocket so they can get back to work and right back to work when businesses begin to reopen the way that they were.
And speaking of businesses, you're a small business woman and have always been an advocate for small businesses. What are you seeing in there in terms of more PPP loans?
So this is one of the best parts. We recognize that there are particular businesses hit the hardest. So those that have seen 30%, this is what we're looking at. 30% decline in revenue, at least one quarter during COVID would be at the front of the line, and businesses 300 people or under. So Main Street businesses, small businesses who saw the biggest hits. We're seeing additional help, and thank goodness for live venues, theaters, restaurants, of course. Those are the industries that have taken the hardest hit. Transportation, we've got a big, here in Iowa, we've got a big motor coach company that operates out of Iowa. They're taking a huge hit because people aren't traveling or doing as much from a business work perspective and taking people around. So those are the areas where we're going to see the money go to more readily, and it's where we need it because we've got to keep Main Street alive.
You mentioned you're a newcomer. You're actually going to be the veteran there in the Iowa delegation, and also the only Democrat. What will that be like for you working together with your counterparts here?
Obviously, I'm very sad to see my great colleague Abby Finkenauer and, of course, Dave Loebsack go. We were able to accomplish so much, getting tax extenders through that our opponents couldn't get in their previous terms. Addressing rural health care in a very dramatic fashion by working together. But I have talked to our colleagues that will be joining me from districts 1 and 4. We're already starting to talk about our first in-person dean or delegation meeting, but I certainly have assurances from them that we all hope to work together, that we understand that we're going to get things done by working together. I explained to them literally chasing down the speaker with Representatives Finkenauer and Loebsack in tow. And I said, you know what, for us to get things done for Iowa, we're going to have to do that. And so be ready, because we oftentimes are overlooked in our state, and it takes a power trio to really make sure that Iowa gets what it needs.
And just quickly, I don't know if you want to weigh in on the Rita Hart decision to bypass the courts. The Iowa delegation signed a letter yesterday, except for you. How do you think this should be handled?
Well, I think we can all see that anytime somebody says again that my voice doesn't count, we need to sit them down and give them a schooling, because this really shows that every voice counts. And that's what I want to see. I want to see every vote counted. Absolutely, I wish this could have been done at a state level, but apparently, according to Rita, the time constraints didn't work. And we're down to a 6-vote difference here. I just want to make sure that it's a fair count and that the right person, whoever wins, gets seated. Do I wish that could have been done at a state level? Sure. She's exercising apparently a federal law that she can, that has been exercised many cases before by federal offices. And it's truly to get, to make sure that every vote counts. And I've seen writings where both Rita Hart and Mariannette Miller Meeks have both said that they believe some votes haven't been counted, votes they believe could favor either one of them. Let's get the votes counted. Let's make sure every single person in Iowa who wants to make sure their voice is heard knows that it does mean something.
And still ahead, we talk with a medical professional who just received a COVID vaccine. He explains how it went and what goes into each dose.
Well, I was on my way to work
The second coronavirus vaccine to be approved for emergency use in the U.S. is making its way to states across the country this morning. UPS and FedEx trucks will roll out today. Hundreds of healthcare workers in Iowa received Pfizer's COVID vaccines this week. KCCI's Cynthia Fodor talked to a doctor at Mercy One about how things went.
Thank you for taking the time for us today, Dr. Vermuri. So you received the vaccine this week. How do you feel? Any side effects, and what's going through your mind?
Yeah, I received it yesterday, about 24 hours ago, actually. And the only effect that I'm feeling is slight discomfort in my left upper arm where I got the shot. On a scale of 1 to 10, I would say maybe it's a 1 or a 2. It's not interfering with anything that I have to do, just a slight discomfort that you would expect after getting a shot.
And you said you felt somewhat relieved and yet a little bit anxious.
Yeah. So, that there's relief that finally we have the tool that we've all been waiting for. I mean, we have some very good tools, very low-tech tools that we've been harping on for a long time now. And a segment of the population is utilizing those tools, but, not everyone is. And as a result, we've had this ongoing pandemic. So in addition to those tools like social distancing, wearing a mask, avoiding large gatherings, especially indoors, in addition to those, most of us feel that, at some point we need to get a significant level of immunity, so-called community or herd immunity. And to accomplish that, we need the vaccine. So relief because the vaccine's finally here, which is actually an amazing thing. It's an amazing scientific achievement and technological achievement. In just many ways, it's amazing because on average, it takes about 10 to 12 years from inception to marketing for vaccines. And here in about 10 months, actually, we have not just one, but probably two, because the Moderna one will likely get approved next week in such a short time interval is truly amazing. So hope and relief in that respect, but also some degree of anxiety because we know the logistical hurdles we'll have to face in trying to vaccinate a good chunk of the 330 million people that live in our country.
And you just said you need 70% to achieve that herd immunity, but the polls or surveys show that 61% of the people may be willing to take it. Some fear getting the vaccine. Can you explain how it works and how it does actually not give you COVID-19?
Absolutely. So there are different ways that people can develop vaccines. The Moderna and Pfizer vaccines are both so-called messenger RNA vaccines. So what scientists did was they took the genetic instructions that the virus uses to hijack our cells and cause our cells to produce proteins that the virus needs to replicate and infect other cells. So they took very specific genetic instructions for something called the spike protein, which is what the virus uses to attach to our cells and gain entry and cause infection. So messenger RNA is the molecule that typically codes for this spike protein. So they synthetically synthesized a fragment of this messenger RNA, and the Pfizer and Moderna vaccines basically give you some of that in the form of an injection. Our cells then take up this messenger RNA and generate spike protein, but nothing else but the virus. I mean, it's not really the virus, it's just the spike protein. Our immune system then recognizes the spike protein and produces a vigorous antibody response. And then those antibodies, then when they encounter a real coronavirus producing real spike protein, recognize it and destroy it and prevent it from establishing itself in our body and causing infection. So vaccines typically are designed to somehow stimulate our own immune system to recognize whatever virus or bacteria we're trying to prevent from gaining access to our body and causing us infection. So people should not be concerned at all about contracting COVID from the vaccine, because there is no actual virus involved. It is a highly sophisticated vaccine that uses just the genetic instructions to make a component of the vaccine, a component of the virus, whereby our immune system can recognize it. So when it really sees the virus in real life, it can neutralize it.
Coming up, we look ahead to what's next in the vaccine rollout, plus when the public might get their first doses.
Trying to help your parent make a decision about assisted living.
Welcome back. We continue our talk with Dr. Ramiri about the first doses of Pfizer's COVID vaccine. KCCI's Cynthia Fodor asked him about the struggles we still might see moving forward.
The distribution started this week among healthcare workers in hospitals. I think the hospitals each received about 800 doses. Any idea how that's going this week? Is it just a day-long process of inoculating the workers?
Absolutely. So about 2 months ago almost, we received what was called the vaccine playbook from the government and from public health authorities. And we've been meeting in small groups for the past 2 months, planning and deciding on a tiered system of who would get it first based on guidance from public health. And we had all those processes in place, and we actually did a dry run late last week, fully expecting to get the vaccine either on Monday or Tuesday, and we happened to get ours on Tuesday. And yesterday, we vaccinated about 10 people, including myself, to work out all the kinks. And then we started a full-fledged vaccine clinic today. By using this type of process, we hope to be able to vaccinate anywhere from 160 to 190 people per day. And we have this is called phase one of the vaccine rollout. The Advisory Committee on Immunization Practices, which is a body of the CDC, recommended that in phase one, healthcare workers on the front lines and nursing home residents are the ones that are to receive the vaccine first. So with that in mind, I think Pfizer shipped 26,000 or maybe 27,000 doses to Iowa. And then based on surveys filled out at least a month or a month and a half ago, the Iowa Department of Public Health then distributed those vaccine based on those survey results. And then those institutions that received the vaccine are then engaging or, starting their playbook that they've been working on for the past 2 months in getting the vaccine to the people that need it.
Is there enough of a supply for everyone and even people in rural hospitals?
Yeah, that's a good question. Of course, we expect to exhaust our current shipment in about 5 to 6 days, but that's just in time to get the next shipment. The shipment. The way we understand it is, we will likely get a shipment every week until we're able to vaccinate all the people on our list. Now, one has to remember, in addition to people working in the hospital, health systems like Mercy One or Unity Point or any health system also has clinics. So we have to take care of all the people in the clinics as well, who also on a daily basis are at risk because of all the patients that they see.
And when do you think this will be available to the general public, more widespread?
Yeah.
Springtime?
It could be that there's a committee called the Infectious Disease Advisory Committee, IDAC, that has been constituted by the state health department. Dr. Padati, I believe Mr. Ken Sharp are individuals that are involved in conducting these meetings. We've had a couple meetings so far. And we've been focusing mostly on the phase one portion for the first 2 meetings. But starting next week, we'll be focusing on phase 2 and 3. And so by the time we get all the nursing home residents and all the healthcare workers taken care of in the state of Iowa, it may be middle of January or maybe even the 3rd or 4th week of January. So by the time the next group of people are eligible, it might take that long. By the time the so-called general population, meaning people under the age of 65, people without coexisting conditions, otherwise, healthy, middle-aged or young people, they may not be able to get it until May or early June at the latest. Now that's provided that, everything continues to work smoothly. Like I said, there are potentially a lot of logistical log jams, but hopefully everything goes smoothly and the companies can keep up with the production and we can procure the vaccine.
And next on Close Up, airports are expected to be busy this week with families traveling for the holidays. We take a look at what's being done to keep people safe.
For 25 years, Renewal by Andersen
Well, more people are expected to be filling up airports this week for Christmas. KCCI's Cynthia Fodor spoke to a member of the Des Moines Airport ahead of the holiday travel.
For Christmas, I know the CDC has recommended against flying anywhere, but they did for Thanksgiving, and that didn't stop people.
So for the upcoming Christmas holiday, we aren't quite sure if we're going to see any increases in travel. It does seem to be a little bit slower for the month of December. However, the airport will remain open for anybody who does need to travel during the holidays.
So it seems slower than Thanksgiving?
Yes. Christmas, the week leading up to Thanksgiving, saw a little bit of increases. We're just not quite seeing that. Actually, numbers are looking a little bit more down, around 75% compared to 2019 numbers. And we were around 50-60% when we look at the Thanksgiving numbers. So maybe perhaps this year folks are either staying at home or traveling locally.
And for those who are going to take to the skies, what COVID protections do you have in place? Are you doing anything differently?
So if you are traveling for the holidays, here at the airport, we're keeping our cleaning protocols in place that we've started since the beginning of the pandemic. So you'll find plenty of hand sanitizer. We do ask that you wear a mask throughout the duration of your time here at the airport. All the airlines are requiring masks as well, so just prepare to mask up. A quick tip would be pack another mask in case something happens to yours. So pack a couple extra masks, and TSA is actually allowing you to bring up to a 12-ounce hand sanitizer with you in your carry-on luggage as well.
Always during the holidays, arrive early, plan ahead.
Yeah, tips around any busy travel time would be plan ahead, make sure that you arrive early. You can find all parking availability and flight status at flydsm.com. Another quick tip is check in online, bring carry-on luggage to kind of expedite yourself and remove some of those touch points that may exist along the way. And then if you are bringing Christmas presents with you, we would advise don't wrap those until you get to your destination, just in case TSA needs to inspect that item.
And if they found a wrapped Christmas present, what happens?
If a wrapped Christmas present needs some additional screening, TSA would unwrap that gift, and you might not be able to wrap it back up. So one easy way is to just wait until you get to your destination to wrap that gift.
Thank you for joining us for KCCI 8 News Close Up. We'll see you back here next Sunday.